Well, Bazalwane, we had a wonderful weekend this week, and God has blessed us with a generous giving of proactive health solutions that has brought Gitina, the nursing sisters, to come and do a test on our cholesterol, our glucose, including knowing our HIV status if you want to. And it has been a pleasure. So I want to be able to ask your representative, your proactive health solutions, why they thought this should be coming to this community.
Thank you, Pastor. This month is Nelson Mandela month, so we've made a dedication to ourselves and the company to say that how are we giving back to the communities that we get businesses from and so forth. So in collaboration with our CSI interventions, we've decided to approach a number of communities in different provinces to try and give back to communities and come in and test senior citizens, the community members, and so forth, just as a way of giving back to society, to show that we appreciate even the support that we get from the individuals from the various societies that we are testing.
So in terms of these services, today what is going on in terms of the various areas that are here? And I would like just nje briefly ukuthi abantu bazi namhlanje ukuthi kwenzakalani. We know that we have our health and wellness team, but namhlanje, why all these gazebos around the church?
Okay, basically these are the gazebos that we set up for general medical screenings. So we start over there with Bernard, who takes your weight and checks your height. Yeah. Once he's done doing that, he then gives out wellness passports. Then you move on from that station to these very gazebos. Inside the gazebos, there's nurses that have wellness bags that check your blood pressure, your cholesterol, your body mass index as well, and they give you insights as well on how to take care of yourself based on the results that you get. Abantu abamnyama isikhathi esiningi abanakho kuba no goals lokuthi bahambe bayotesta nje noma ucheck ukuthi umzimba wami wenza kanjani nje unjani, dinga ukuthi umuntu azagule before ayocheckwa. So sithe thina size lana ke sonchecka nje, hayi ngoba konakele lutho akukho lutho khokha lutho mahala nje, ngizofika nje niteste umuntu athola ama results akhe abuyele ekhaya. Useyazazi njalo ukuthi inhliziyo yamshaya kancane noma ishaya kakhulu noma ikanjani.
Siyabonga. I've got my wellness passport. Do you have yours?
I'm Zolega. I'm here with Usipo, who has just did the testing of the wellness campaign for Mandela Day. And Sipo, will you please tell us about the process, what's happening there, and what do you do?
Okay, firstly, you start by taking the height, they measure the height and the body mass. Okay. Then secondly, you have to go to one of the rooms. Then that's where they take your sugar, okay, and they take the cholesterol as well. Then after, when you have done, you go to the tent, the next tent, the second one. Yeah, it's for blood tests.
So what did you test for?
I tested for everything that's written here in this wellness passport.
We're here with
Mapiello.
Mapiello just did the testing process.
So first I got weight, and then check.
You got your weight measured, and
it's your weight, and then your height, and then I got I got my cholesterol level and glucose level tested, yeah, and then I got my BMI as well.
So are you happy with the process?
Yeah, I'm happy with the process, and I'm okay, I'm healthy, but then it helps you to keep it up.
Here we have Mr. and Mrs. Muchaisa, who's going to tell us about the process and how they feel about their testings. And Mrs. Muchaisa, how did you feel, and what did they do inside the tents?
I think it was awesome, first of all, because it's imperative to take care of your health. And then you just went inside and they take your details like your height and your weight, and they take details for like testing your blood as well. Yeah, so I think it was perfect.
Okay, Mr. Muchaisa, how does it benefit the community?
I think that the community it's benefiting by knowing like where they stand in terms of like their health, and then it's quite a very, what can I say? It's a good thing that the church is doing, because most people are afraid, or they think it's expensive to kind of like get themselves checked up. And then it's very good that the church is making it free for the community, you know.
Okay. So both of you, do you think this should be done again?
Yes.
This is Sister Zandi, who's going to tell us about the process. Sister Zandi, how are the patients of Chief Lutuli Lutuli Park?
I'm a client wethu. It was you know, we are honored to Sibelana, and then we've the whole weekend it was nice. We were, you know, sabas welcome kahle, and then we are happy about the way by attending a corner. The attendance was very good. Yeah, and then, you know, it's very important to abantu bazi status sabo, especially masesizile saletha i-service. At least people must bring themselves, ba-check bakwazi ukuthi bakwazi ba-check abo shukela, ba-check i-BP, abo cholesterol, and the status HIV. So it was very successful. We are happy.
Okay, so do you think we should do this again?
Yes, I think we should do it regularly, like let me say yearly, if possible, or twice a year. You know, yeah, for those people who cannot buy guma clinic or gubo doctor. You know, at least when we are here, it's a chance yabo yokuthi at least pass check.
Okay, asiyabonga mama.